Hi, my name is Dr. Sarah Wasserbauer, and I'm here to tell you how to take the ABHRS oral exam. The American Board of Hair Restoration Surgery is the only recognized board exam to certify your expertise in hair restoration surgery. Whatever type of surgery you perform, follicular unit excision, linear excision, or a combination of techniques, taking the board exam demonstrates your commitment to excellence in diagnostics and surgical planning with superior outcomes for your patients, and it demonstrates this commitment to the whole world. If you are studying to take the oral and written exams and have already been accepted to take the exam, the hard part is really over, because in order to be eligible, you must have already performed enough surgery to have a basic understanding of this subject material, and that is what the oral exam is testing, your core competencies as a hair restoration surgeon. The oral exam consists of 3 protocols in which the examiners play the role of the patient and you play the role of the surgeon. This is simulated clinical problem solving. Each of the 3 cases consists of patient situations you are likely to encounter in the usual course of your practice, especially situations that will impact your choice of treatment or your surgical routine. For instance, you might be presented with a patient who wants an unnaturally low hairline, or a patient who has a latex allergy, or maybe undiagnosed lichen planopilaris. There are no secrets in these cases, no tricks or deliberately misleading statements. It is given in English, and you're encouraged to bring a translator if you feel you need one. You can re-ask a question. Each protocol takes about 20 minutes to complete, but if you finish earlier, that's fine too. As long as you finish within the time frame, the time you take to finish the exam does not get figured into your final passing or failing grade. If you go over, the proctor for the exam will let you know that it's time to finish. Here's how the exam goes. You will come into the room and there will be paper and a pen available. No other materials are needed, so you don't have to bring a book or a calculator. There will be 2 to 3 examiners. One is often an observer, and these examiners are made up of current diplomates who have sat in exactly the chair you are sitting in, so they understand what you are going through. Names are not used, and any examiner or examinee who feels there might be a conflict of interest because they know you or you're practicing in the same location, the examiner will recuse themselves from grading your oral examination. So, walk into the exam as if you were walking into a normal examination room for a consultation. Take notes and a full history just as you would in a normal situation. You can write yourself a short little outline just as soon as you walk into the room. For instance, you can write a list: chief complaint, history of present illness, past medical history, allergies, surgical history, patient medications, family history, social history, review of systems, physical examination, vital signs and general physical exam, scalp examination, and a biopsy if you feel you need it. You can also ask for different laboratory studies, and if they're relevant, they will be given to you. Having done these exams for years, if there's one piece of advice that most examiners would give to an examinee, it would be exactly what I just told you, to write yourself a short little outline just as soon as you walk into the room. There are plenty of excellent surgeons who have developed complete temporary amnesia when faced with their first exam, and sometimes people fail the oral exam. If this happens, don't worry. You can retake the exam, and it is not noted once you pass whether you've taken it once, twice, or 3 times. A candidate who fails the written or the oral exams, or both, may retake the examination without reapplication by submitting a written request and the examination fee. The ABHRS is a non-for-profit agency. We do not make money off of examinees. Our whole purpose is to make and give this exam. There is no limit to the number of attempts a candidate may take to pass the oral and written components of the annual certifying examination. In addition, there is no time period in which the written and oral components must be successfully completed. However, a candidate who does not pass both components of the examination within a 3-year period must complete a new application. The existing application does become void. So walk into the oral exam with the confidence that you will pass it and that nothing the examiners throw at you will throw you for a loop either. This examination is there for you to be able to prove your expertise to the American Board of Hair Restoration Surgeons and join those of us in the ranks who have already proven our dedication to our patients. I wish you good luck.